Hello, my name is Stella Duncan, and today I'll be discussing my research in which I used polygenic risk scores to validate clinical diagnoses of psychiatric disorders. This work was done under the supervision of Dr. James Kennedy at the University of Toronto and focuses on integrating genetic data into clinical diagnostics to improve the treatment of psychiatric disorders. Psychiatric disorders are highly polygenic, meaning that multiple genes, in addition to epigenetic and environmental factors, contribute to an individual's risk of disease. Therefore, symptoms and treatment response can vary significantly between individuals and result in a decreased quality of life for patients as they struggle to find effective treatment. It's therefore essential to develop more personalized approaches to pharmacotherapy. Now, how do you estimate genetic liability to a trait or a disease? First, you need a genome-wide association study which identifies genetic variants one by one for the disease phenotype of interest. Then you can compute a polygenic risk score to sum all of these small genetic variants across the genome into a single score, where a higher score indicates a greater risk for the disease. The key question driving my research project was, are polygenic risk scores associated with the case status of specific psychiatric disorders? To answer our question, we looked at a subset of individuals from the IMPACT dataset diagnosed with ADHD, anxiety, depression, bipolar disorder, and schizophrenia. To calculate each genetic risk score, we used a large GWAS for each disorder, computed the PRS score, and then we tested the PRS score with case diagnosis using logistic regression. Our analysis revealed significant associations between the genetic risk score and the psychiatric disorder status for ADHD, bipolar disorder, and schizophrenia. Specifically, the PRS for these disorders were found to be higher in patients than those without them, indicating a genetic association. Secondly, we wanted to see whether the polygenic risk score of neuroticism was associated with these psychiatric disorders. We wanted to look at neuroticism as it was found to be the single strongest predictor for common mental health disorders, and we wanted to see whether polygenic risk scoring could help determine which disorders was genetically associated with neuroticism. We found that the PRS was significantly associated with anxiety, suggesting a genetic overlap between neuroticism and anxiety disorders. In conclusion, PRS show promise as a tool to enhance the prediction and diagnosis of psychiatric disorders, particularly in ADHD, bipolar disorder, and schizophrenia. The association between neuroticism and anxiety suggests that PRS could be used to guide more personalized treatments. Moving forward, we hope to explore the potential of PRS in predicting medication response and symptom severity, leading to more tailored and effective treatments. Thank you for your attention. I would like to thank the Kennedy Lab and the Amgen Scholars Program for enabling me this opportunity. And here are my references.